Good evening. Welcome to another Game Ready Series event. I'm Hailey Benningfield. I know I'm not Dr. Worsham. He is in the operating room, so I will be here with Dr. Simonich talking about on-field management. Dr. Simonich?
Hi, I guess I'll introduce myself first. I've been a physician in the Orthopedic department at UT since 2007. I'm from Houston, but I kind of grew up all over with my dad working in the oil business. And then I went to the University of Notre Dame from Klein High School, and then to UTMB Medical School. Then I trained in orthopedics at the University of Florida, and that's kind of where I started to get interested in sports medicine. That's a subspecialty of orthopedics where we follow the Florida Gators and a lot of their sports. And then I did a fellowship in sports medicine out in California at the Southern California Orthopedic Institute. And then I was in Florida for a few years before I returned back to Texas and Houston in 2007 and been covering the sports teams in high school out here in Katy and in the Memorial City, Spring Branch area since that time, and enjoying it very much.
Awesome. What teams do you cover?
Currently, I cover Stratford High School and Taylor High School, and I've been doing Taylor High School the whole time since 2007.
Awesome.
Yeah.
Well, let's get started. Okay, so can you walk me through the steps when
a player gets injured?
Yes.
Yeah. So first thing I'll say is what people don't know, when a child goes down or a player goes down, the family in the stands, it's a very apprehensive moment for them. And what a lot of people don't realize is there's a lot of things set up in advance. There's an entire EMS system that's at every game, and that's not just for the players, it's for everyone in the stands. It can be for the cheerleaders, for the dance team, for the band. And that's a huge schedule, and the independent school districts set up those schedules, and they're very organized, and they really should be applauded because that's really helpful to us as physicians to have that as backup. The other thing people should know is it's not random as what doctor shows up. As we just mentioned, I quote unquote cover a few teams, which means I'm responsible for being there at most of their games, and we go to most of home games. Occasionally we'll miss an away game because we know another physician will be at the home game for the other team. And that schedule is set up on a big schedule that's like a big grid where everyone knows where they're going to be that whole season. And in addition to just orthopedic surgeons being at the game, we're lucky enough here in Houston to also have a strong team of primary care physicians that also help us. Because players don't just have orthopedic injuries, sometimes they have heat exhaustion or a cold or skin infection that the primary care doctors help us treat. And that's a huge part of that. And then one other thing I would say is we have a huge subspecialty program in the UT Orthopedic department. We're very lucky. We have maybe 90 faculty throughout Houston that cover every major subspecialty of orthopedics. So if there's anything that we think needs another look, we have access to those subspecialty team members that may not be covering games, but that we can conference in and talk to, and it's fantastic.
So talk to me about a player gets hurt on the field. What does that return to play assessment look like?
Well, that was a great question, and before I answer that, I would just say that our athletic training staff is the most important part of this team of people because they are directly working with the athletes every day. And they're a great liaison between the medical team and the coaching staff as well as the parents. And so it's not unusual for me to get a text from the athletic training staff that tells me about a player that needs to come in and see us. And then we call the family and get them in, and that's a very easy way that we communicate. We're very open and in direct contact with one another. Now, with respect to that player that goes down on the field where the parents and the grandparents and siblings and even friends, if a player goes down, it's a very apprehensive time for that family, and they're immediately worried that something seriously wrong has gone on. And as you've seen probably being in the stands, if you're a fan of football, for instance, you may see a player after 2 minutes of being on the ground jump up and run back to the sidelines like nothing happened, or they may actually have to call an ambulance onto the field. And again, that happened just last week that both Dr. Worsham and I were both involved with, that went all the way to the hospital. But what's going on when we run out on the field is the athletic training staff is out in the field. Often you'll see a coach. We're protecting the player and we're assessing things right away. And we typically are just assessing things, and we call them the ABCs of assessment. And then we also include a D and an E. So we're making sure they have an airway. We're making sure they're breathing and that we're checking their pulse for circulation. We're checking for any disability that we can observe, like a limb that's not in good alignment. And we're also checking for the environment. In Texas, obviously, we're worried about heat more than the north, where they're worried about cold weather. So if obviously the player is talking to us, we know that they have a pulse and that they're breathing and that they have an airway, so that we can assess their injury. And often, clearly, if someone's unconscious, then we have to sometimes we have to take off this face mask that you see, and the training staff has all these incredible tools to do that, and that will give us access to the patient's airway. And luckily, we don't see that often, but once we assess that situation and make sure that player is safe, then we can go to what might be injured, whether or not it's an ankle or a knee or a shoulder or a concussion. And sometimes the player just got the wind knocked out of them, like I said, and they just need a little bit of time to recover, and then they trot off the field and everyone's clapping. That's what we hope for.
So can you give us some examples of some injuries that you see?
Yeah, so I'll keep it in kind of simple terms. We'll talk about, for instance, like a shoulder dislocation, which unfortunately happens in football all too often. And if a player is on the field and we've done all those A, B, C, D, E assessments, and we notice that their shoulder is out, we'll often take that player once we've made sure they're safe and get them to the sideline where they're not in the middle of the field with the bright lights. We may even take them to the training room that's up near the locker room if we need to. And you'll see in NFL and Division I college football now where they have those tents that they're taking people in. That's to get a calm environment. It's a little bit of a privacy thing too. And in the case of a shoulder dislocation, sometimes they'll pop in by themselves, and often we have to do a reduction maneuver, and it's a lot easier for a player to relax for us to be able to do that if they're in a calm environment. And then that is often the best time to do it because the player hasn't sort of had a spasm of their muscle, and it allows us to be able to perform that form and not have to go necessarily to the ER. In cases where we can't reduce it, that may be the case, and we'll see them in the emergency room where they have better medication for that. Another example might be the typical thing you hear about all the time, which is an ACL injury. And those players don't necessarily have a deformity that can be seen, but they're obviously complaining of their knee. Again, after we've done that big assessment of all the things that are most important to save their life, we're going to kind of hone in and localize where they're hurting. And in that case, they would obviously be complaining about their knee. And you'll see on TV a doctor or a trainer grab the knee and do these little maneuvers, and that's what they're checking for. They're checking for those ligament injuries. And if a player has a suspected ligament injury, or even if you don't suspect it and they're hurting so much, they're going to get up maybe on some guy's shoulders and walk off the field with their good leg, and then we do another assessment. And I think that goes, in this talk, we're talking about on-field management, but that on-field management often becomes sideline management. So now we're going to the sideline where we're assessing, okay, maybe he didn't have an ACL injury, and that kid hops off the table and grabs his helmet and is ready to go. And you're like, whoa, what just happened? And again, some players will act very injured and then they'll be fine, and sometimes they don't act injured and they're really injured. So what we're doing on the sideline in those assessments is, okay, now we have a player who feels better, and we're going to make sure that they can safely maneuver, have good strength, good range of motion, can do cutting drills on the sideline in order for them to be able to go back into the game. Because one of the things that we need to determine after the on-field assessment and sideline assessment is, are they ready and safe to go back in the game? It's another big part of it. We're sharing all that stuff. I can't tell you how many times the coaches come over and they're just trying to figure out, not only are they certainly cared about their player, but they want to know what they have to count on going back into the game from an assessment, from a personnel standpoint. In the case of a kid who may have injured his ACL and doesn't get good range of motion, we think you're out for this game, they will then have an assessment in clinic and likely get an MRI and that type of thing. And we're also lucky in KDISD and Spring Branch where we have access to imaging pretty quickly, even on weekends sometimes. So we're thankful for that too. And again, that is a huge organizational structure with our major sponsoring hospital in Laurel Herman who allows us to do that.
So are there any other injuries or is there anything else you would like?
Probably one of the other things would be fractures. I mean, that's one of those things where obviously in slow motion television and people cringe when they see people's, tibias break or something like that. Well, luckily we don't have slow motion in high school football that the fans are watching, thank God. But those injuries are serious, and when that player has that type of injury, even an open injury where the bone is kind of come out of the skin or something, those need to be assessed in the hospital. And that's where you'll see the backboard come in and a full team of medical personnel and transfer to the hospital in an ambulance. And that call is often made by the physician to get the EMS involved, whether or not that's the orthopedic surgeon or the primary care doctor. And basically that's that D in the assessment, like disability. And obviously a grossly malaligned limb is an obvious thing that you can assess. So, just in general fracture care. So,
is there anything else that you would like?
Yeah, I think the last thing I would say is it's our responsibility as physicians really to communicate with the families primarily. When a player goes down and everyone's running out on the field and the parents are freaking out in the stands sometimes, we want to make sure we talk to them first. So we'll bring that player back, hopefully to the sidelines. If they have to go in an ambulance, the first people we're seeking out, with the help of the training staff who are tracking them down, by the way, in the stands, is to communicate with them so they can feel good about their child and what's going on. And then, of course, we communicate with the coaching staff and the training staff and further their care. So communication, I think, if we wrap this up, is probably the biggest part of on-field management is secondary to the assessment of the player. And I think we go a long ways to do that. And I would even bet that Dr. Walt Lowe would probably say, I think he gets a lot of praise for his ability to communicate with the Texans, and I think he's even won some awards for that. So,
thank you, Dr. Simonich. We really appreciate it, and I know I learned a lot about just what happens when a player gets hurt. So we thank you for your time, and hope to see you soon.
You bet. Thank you.
Thank you.